Hi, everyone. Thanks for joining me. I'm Dr. Heather McCauley, an assistant professor in the School of Social Work at Michigan State University. And today I'm going to be sharing with you a presentation called Centering the Margins in Sexual Violence Prevention. This is an opportunity for me to share with you where my team is in our thinking about sexual violence prevention and the recommendations we have for the field about next steps. So I'm a social epidemiologist by training. So if you were in front of me, we'd unpack what that is, and I'd give you a couple guesses. I don't have that opportunity, so we'll just jump right into it. An epidemiologist is, the field of epidemiology thinks about health and well-being from that 30,000-foot perspective. So I think right now, epidemiology is certainly in the news with an infectious disease outbreak, and we think about problems from that 30,000-foot perspective. How do these trends look like over large swaths of the population? But social epidemiologists think really critically about the social determinants of health and how things like racism, classism, sexism, homophobia, transphobia shape those patterns of health and well-being in a population. And for me, violence is my public health issue. I've been interested since the beginning of my career in understanding what those trends look like and who is at disproportionate risk for sexual violence in particular. I'm also a mixed methodologist, and I do a lot of community engaged work. I emphasize community engaged research to maximize impact. If we're working with the populations who are experiencing violence from the beginning of our work, we're more likely to ask the research questions that matter to those populations, and we're more likely to design interventions and prevention programs that are going to actually address the problems that they identify in their communities. And my work aims to center the margins in research on violence against women. So what do I mean by that? You'll see here I'm sharing a key resource that we just published in the 25th anniversary issue of Violence Against Women. And it's a piece that really unpacks where our field needs to be moving over the next 25 years. Because the prevalence of sexual violence, as we'll talk about, has remained remarkably stable. And so we need to be doing things differently. So this piece that I co-wrote with Dr. Rebecca Campbell, Dr. Nicole Buchanan, and Dr. Carrie Moylan recommends an intersectional, community-engaged approach to this work. What do we know about sexual violence? I'm not going to spend too much time about this on this today, but we know that it's common. We know that certain contexts shape vulnerability to sexual violence. We know that it harms survivors' health for the rest of their lives. We know that it's hard to share what happened to us. And we know that it can be prevented in some contexts. But history matters, so most of us assume that the anti-rape movement started here. If you were in front of me, I'd ask you to tell me when this picture was taken. This reflects mobilization in the 60s and 70s with the women's movement, and most of us think this work began here. And incredible, really pivotal work happened during this time. But in fact, the work began long before and was led by women of color. So this picture here is of Rosa Parks. So before we knew her for the bus boycotts, she was working for the NAACP as a sexual violence investigator. Here's a key resource for you written by Danielle McGuire. I think I'd recommend that everyone read this book, really outlining the history of women of color in this movement. And our work has been driven by a single narrative to date. And this is one of the key problems that my team and my colleagues and I have identified as to the reason why we haven't moved the needle on sexual violence. So why is this problematic? Our understanding of the risks, the context, and the consequences of sexual violence are based on primarily white women's experiences. That's that dominant narrative that we use to understand what sexual violence looks like. That also means that our prevention and response efforts have been built based on white women's experiences, raising questions about whether our prevention strategies are as effective for other populations as they are for those who identify as white, heterosexual, cisgender women. And so my plea is that we continually challenge what we think we know about sexual violence. Because we know, as Audre Lorde pointed out, there's no such thing as a single issue struggle because we do not live single issue lives. So in this piece that we published in Violence Against Women, and many of us in the field have been talking about more intentionally weaving intersectionality into our work. The understanding that our social identities are dependent on other social identities that we hold, so that I'm not just a woman, I'm not just white, I am a white woman, and the privilege that I experience as someone who is white identified intersects with my experiences as a cisgender woman. And each one of us move through the world differently because of our unique combinations of social identities. Our social locations reflect layers of oppression that place each one of us at different levels of risk for a variety of types of victimization, an increased frequency of victimization. So again, we often in our field study white heterosexual cisgender women and talk about sexual violence through that lens, often ignoring women of color, trans people of color, LGBTQ people, who I'll be talking about a little bit more today. And that might be hindering our prevention and response efforts. We know, based on the work of Carrie Moylan, Robert Coulter, and others, that structural factors increase risk for sexual violence. So from the campus sexual assault literature, we see that campuses with a greater proportion of students who identify as LGBTQ or experience discrimination have higher rates of sexual violence. So some of the work that I'm doing with Dr. Moylan and my colleagues here at Michigan State are unpacking what we think about and define as climate, and recognizing that other kinds of discrimination that our queer and trans students, for example, experience are completely related to their experiences of sexual violence. What do we know about sexual violence among LGBTQ college students? Here I'll talk about college students just because we have such an abundance of literature on these experiences, and some of my work now is focused on this particular population. We know that LGBT college students are more likely to experience sexual assault. So here are data from the AAU Campus Climate Survey, the 2015 version. And you'll see here the yellow bars all the way to the left represent gay and lesbian identified students. The red bar in the center represents bisexual identified students. And the bar all the way to the right are those students who identify as heterosexual. And you'll see that gay and lesbian students are at greater risk for sexual assault, or more likely to report sexual assault compared to heterosexual students. But over and over again, we see that bisexual students experience the highest risk. This is a graph that is from one of my papers that is in press at American Journal of Public Health. This is a sample of students seeking care in 28 college health centers in West Virginia and Pennsylvania. And you'll see here that the prevalence of sexual violence at baseline is significantly higher than the general population, but that's what we expect in healthcare settings. We see this in other studies because we know that sexual violence impacts people's health, so they're more likely to be seeking care. But regardless, you'll see the line on the bottom are heterosexual identified students, and the darker line above that are sexual minority identified students, so those who identify as lesbian, gay, bisexual, or queer. And while their patterns over time at baseline, 4 months and 12 months follow the same trajectory, you'll see that sexual minority students experience more violence over the course of their lifetimes. In this case, in this slide, over the course of a year in college, compared with heterosexual students. We also see that sexual harassment on campus is ubiquitous. As many as 75% of transgender and genderqueer identifying students have experienced sexual harassment. It's also quite prevalent for heterosexual, gay and lesbian and bisexual identified students, with gay and lesbian students on the left, bisexual students next to them in the red bar, with the red bar, the maroon bar is heterosexual students, and then trans and genderqueer students all the way to the right. And these data, again, are from the 2015 AAU Campus Climate Survey. We also know that students in general come to campus with histories of violence victimization, experiencing discrimination because of their various social identities, and those things shape their experience on campus. We know from Mark Friedman's work, my own that I've published, that LGBTQ LGBTQ youth are significantly more likely to experience sexual abuse, parental physical abuse, or assault by their peers, intimate partner violence in their intimate relationships. And this is important because once they experience violence once, they're more likely to experience it again. And we know from research that re-victimization is devastating for survivors. It exacerbates mental health concerns and, again, shapes healthcare-seeking behavior over the course of their lifetimes. From an intersectional perspective, our work has found increased risk for students with multiple intersecting identities. So, for example, this paper that we published, led by Robert Coulter in 2017, we published this in Prevention Science. We found that in an assessment of the National College Health Assessment dataset, that Black transgender students had the highest predicted probability of sexual assault. But more intersectional work is needed, and I think epidemiologists are working together to understand what it actually means to do intersectional work. It's more than just testing interactions of various demographic variables that we have in our data set, which is a whole other conversation. But I encourage us, and I encourage your feedback, to think about how we can make our work more intersectional, to highlight these disparities that should be shaping our prevention and intervention efforts. So why are LGBTQ students at elevated risk for sexual violence? For a number of reasons. We know stereotypes shape risk for sexual violence. So I think especially why we see persistent disparities among bisexual identified people. Bisexual people experience stigma and from both gay and straight communities. So they might experience isolation from the gay community because of their identities. And they might experience that same isolation from straight communities because they don't identify as heterosexual. So they're kind of in this in-between place, not having that connection to community, which could be really supportive. There's also stereotypes of this hypersexualization of LGBTQ people, which shapes risk for sexual violence. We also hear stories of corrective rape, with perpetrators manipulating people's and threatening to out people's identities and use rape as a tool to quote unquote not make them gay anymore. And so these are stories that we hear and are combating and should be combating and addressing in our prevention efforts. I also think about what it feels like for those queer and trans survivors to tell someone what's happened to them. In some cases, depending on their level of and how comfortable they feel being out, they might be coming out as both an LGBTQ person and as a survivor, which can be really difficult for people. So a survivor might not want to share their stories because it would require them to come out. If their perpetrator is in the LGBTQ community, they might be worried about bringing attention to an already marginalized community, and so that might hinder them from sharing what happened to them. So these really unique experiences and experiences of discrimination and these social vulnerabilities experienced by queer and trans people really influence their experience as sexual violence survivors too. As I mentioned, disclosure can be difficult. It is also compounded by this normalization of sexual violence in our culture, compounded by this process of discovery while coming out. LGBTQ people might experience this internalized homonegativity and blame themselves for what happened to them. So that means that our response as prevention experts, as those who provide services to LGBTQ students on campus, can be shaped by our understanding of intersectionality. So our students don't know how we will react if they disclose their LGBTQ. So how does that shape the conversations that we have, the questions that we ask, and the services that we make available for our students? With language, take cues from the survivor, ask about pronouns, model the language that they use to describe their experiences. Avoid assumptions about who harmed them. I have a whole body of research that unpacks the context of the abusive relationships among those who identify as sexual minorities. And so we need to avoid making assumptions about who their perpetrators were, if it's intimate partner violence, who their partners were, and again, take cues from the survivor. But from a trauma-informed perspective, assume that they come to you having experienced multiple traumas already, like discrimination, like violence in childhood, like conflict with families. And those things shape their experience of being a sexual violence survivor and shape who they trust, who they share their experiences with, and shapes really their trajectory of healing after all of these exposures. What about racial justice and sexual violence? We need to be thinking about, we can't be talking about the experiences of LGBTQ students without also talking about the experiences of students of color. Because our national climate affects climate on campuses. And so I hear, campuses are excited to put together really robust programs, even those who have really comprehensive strategies with policies, practices, and procedures to address sexual violence. We have to recognize that our campuses are embedded in larger communities, and students' experiences on campus are related to their experiences the minute they step off campus. So if they're experiencing racial discrimination the minute they step off campus, then that affects how safe they feel on campus too. So we need to be thinking about working with our community partners and thinking about prevention from this broader community level perspective, but also recognizing that our best efforts don't matter if we're not also capturing the experiences of our students the minute they step off campus as well. We saw this in the Me Too movement. There's been so much tremendous attention to sexual violence in the media, and we've seen justice happen for survivors. But we also heard survivors of color in particular say, where am I in those stories? That doesn't represent my experience, or why doesn't anyone care about what I went through? And so I think that reminds us all that our work is not done, and we need to be recognizing and including the voices of survivors who don't fit the narratives that are demonstrated in our popular press. What about intervention? So for those who have already experienced violence, I mentioned that I've been collecting data with a team of researchers in college health centers. And so Futures Without Violence developed these brief intervention cards. The one on the left is for LGBTQ patients, and the one on the right is for trans, non-binary, genderqueer patients. And these are safety cards that walk patients through examples of abusive behavior in relationships and then provide resources for them. So I recommend taking a look at those, available on Futures Without Violence's website. What about our prevention strategies? There is a fantastic book I'll show you in a few slides about our prevention strategies that makes the argument that we have adopted an ahistorical, power-evasive, identity-neutral prevention approach on our college campuses. And so I'll unpack what that means in a second. We know that affirming climates result in better outcomes for students with minoritized identities. So how do we shape our climates? And how do we conceptualize what climate means is completely relevant to sexual violence prevention. And with that, I ask us and challenge us to examine our evidence-based programs, because to date, our programs have been evaluated on primarily white college campuses, four-year college campuses, and have ignored and not asked and examined whether these programs work as well for sexual minority students, trans, non-binary, genderqueer students, as they do for heterosexual cisgender students. So recently I had a paper published with the team from University of Kentucky focused on evaluating Green Dot, identifying that this program in particular worked best for heterosexual students. And it's the only program of the evidence-based programs to date that have published results looking at asking these research questions, which means that our field has a lot to do moving forward to understand, do our programs even work for sexual minority and our gender minority students? And if not, why don't they? Is it because we've adopted ahistorical, power-evasive, identity-neutral prevention strategies for our work? We need to be leaning into some of these structural inequalities that shape sexual violence prevention. So as I mentioned, here's a fantastic resource, Intersections of Identity and Sexual Violence on Campus, Centering Minoritized Students' Experiences. This is written by some higher ed professionals, which I have found really useful at bringing together kind of the public health, sexual violence world, and thinking about how we actually operationalize our recommendations on campuses. So what could our work together look like? Let us recognize and challenge that single narrative and be open to many counter narratives. I challenge all of you to think about where you've been collecting your data and who those data represent. I'm willing to bet that, and we see this in many fields, that we have a story about what this should look like. And what I've learned from talking to hundreds and hundreds of survivors and surveying tens of thousands, that's just not the case. We need to examine the cultural factors, the institutional policies, and political context that shape sexual violence. So again, our national context completely shapes students' experiences on campus. So how do we incorporate that, recognize that, and combat some of the political contexts that have been really harmful for our students today? How else could we do this work? Let us build a table big enough for multidisciplinary collaborations. So for my work with prevention programs, especially to make them more responsive to the needs of sexual and gender minority students, I'm really digging into what our programs should look like, how we push even gender transformative programs to that next level. So I've been speaking with and engaging with masculinity scholars, for example, to really bring in those their expertise to shape this public health approach that we've been using. Let us infuse prevention across multiple entities, working collaboratively to build and sustain community capacity. So prevention is more than one program, it is more than one policy. Comprehensive prevention does include policies, practices, procedures, and programs. But this isn't just happening out of one office or done by one person. So how do we come to the table and bring our various strengths, leverage the various roles that we have within a university system to develop a comprehensive prevention strategy? Let us commit to transformation rather than transactional effectiveness. We are beyond just measuring whether a particular program is effective in reducing perpetration or reducing someone's symptoms who's experienced sexual violence. That's transactional effectiveness. We need to commit to being transformational and completely upending how we do this work together. We have not shifted the needle on sexual violence and the prevalence of sexual violence over time. It has remained remarkably stable. So let us commit to being transformative. Let us listen to survivors when they tell us what they need. Let us listen to survivors when they tell us what they need. Let us have them at the table from the very beginning so that we are asking the research questions that matter to them, identifying who in communities have the ability to make a change and move the needle in sexual violence prevention, and having them at the table from the beginning also helps us disseminate these, what we find, and disseminate these new strategies that we develop together. So let us listen to survivors when they tell us what they need. And finally, let us act with care and competence. Let us act with care, competence, and courage. Thank you very much.